When I was diagnosed at 16 years old, I wasn't supposed to live past 22. I'm now 28 years old and I am not going to allow this disease to hold me back. Imagine climbing a flight of stairs and making it to the top and feeling like you were going to pass out at the top because you could not catch your breath. Imagine that you're on a sports team. You know, the whole team can run a mile and I'm the one that's lagging behind because I can't breathe. After doing a multitude of tests with different doctors, they finally thought I should come to the Center for Lungs and Breathing, where I was finally diagnosed with pulmonary arterial hypertension.
Pulmonary hypertension can be a deadly disease. That is a potentially very scary diagnosis to have, and certainly in someone so young. We took her to cardiac catheterization and discovered that, in fact, this diagnosis was correct. But as part of that assessment, also found that it appeared that she would respond very well to one of our oral therapies. And she really very quickly began to symptomatically feel much better.
This is the medication I take every day in order to keep me going. This is what's saved my life.
When a patient comes to the Center for Lung and Breathing, what they can feel confident about is that they're going to receive a really comprehensive care for whatever underlying lung or airway problem that does exist, from very early disease, moving all the way through spectrum to actual lung transplantation. The fantastic part of being a physician is being able to impact someone's life in a positive way. The rewards of that are much greater than what we give out. But I think the thing that's different about the university is our desire to really push forward in our understanding of ways to take care of patients, turning to really the best clinicians, the best investigators in the country, and say, what can we do to help this individual, to try to get them being able to get a deep breath, to be able to exert, to be able to exercise, to be able to spend time doing what you love doing.
The physicians and supporting staff at the Center for Lungs and Breathing are the reason why I'm here today. Knowing if I take my medication, I'll be fine is, I think, the biggest thing. And if you stop the medication, you could have that expiration date again. You have to breathe to live, but every breath I do not take for granted because I don't know if it'll be my last. So.